And then, will MS stop me from being a good parent? And I think anyone who's a parent worries about that, no matter what you're doing or what the issues are, but we can talk about those questions too.
I'm Liliana Mesco. I'm at University of Southern California, and very similar to what Dr. Chitnis has mentioned is basically when delivering the news of multiple sclerosis and sharing it with your children, it will depend on the stage of the development of that child, not only how old they are, but perhaps what issues may be ongoing with them. Are they teenagers going through identity crisis, et cetera? But there is ways of communicating, and it is, I do agree, she mentioned very important points, that one of the first questions that a child may have specifically, maybe just simply, is my parent, is my mommy gonna die? Am I going to be okay? Is she going to be okay? And how to communicate that with them is very important, and in a way is taking away oneself and thinking about that child and protecting them and letting them know that everything will be okay whatever way it goes. And certainly any questions related to that, we can talk more about that.
Maybe Nancy could talk a little bit about that, being the mother of 5 children.
Okay. When I was first diagnosed with MS, I was a mom of 3 boys. They were 6, 8, and 10 years old, and it was quite a traumatic time, and I didn't know exactly what to tell them or how to tell them. I didn't understand exactly how it was going to affect my life, because I think, as everybody knows, when you're first diagnosed, you don't know where you're going to be a year from then or 2 years from then, and I think it's talking about age appropriate. I went to a child psychologist to to ask what was the right way to tell my children, and I told them what it was called, and it was a big word, multiple sclerosis, kind of hard to get out, and talked about it being an autoimmune disease. It affects the central nervous system, which doesn't mean much to a 6, 8, or 10-year-old at that point. But as they got older, I felt it was really important to be honest, because I think the more you're dishonest, children are so smart, and they sense everything. And when you don't tell them enough, they imagine the worst. And I think the more you can tell your children what's going on in your life, and that sometimes you have days when you're just really tired, and it's because sometimes your MS puts you in a place that you might not have the level of patience you might have on another day, and maybe to go somewhere that's very physically taxing, sometimes you just don't have it. And sometimes it's just a good excuse when you're annoyed too, by the way. You don't want to deal with life. I shouldn't say that. My kids aren't here. I think, I think it's important to do that because kids are really smart, and as they get older, I think it's really important to tell them. I have daughters now who are 9 years old, and they seem to take a lot of pride in knowing as much as they do know and helping out. And I think when your children help out with charity work or helping something that you do, it makes them feel really good that they're doing something. And I think that's a great sense of self to have inside of you, to involve your children wherever you can to be part of this. So that's all. Yes?
I just want to say, it can be a fantastic learning experience for children, because when I was using canes and walkers, I asked my kids one day, I said, what do you think when you see your dad using a walker? How does that make you feel? They go, we don't even notice it. They learn to see people instead of disabilities. And I think that's a great opportunity, if it's presented properly to children, to just look beyond a disability. If it's presented properly, if you can do that with your children, if you feel okay, your children will feel okay about it. And that's my opinion.
You're right, and very often children on some level become a caretaker, and it's important that they have an education as to why and what could happen in the future, and to learn the positives and the negatives, and also to let them know that they did not make it happen. Sometimes children think if I was acting naughty that day, I wasn't a good girl, or I wasn't a good boy, that I caused my mommy to be sick. And I think it's really important that you don't let them blame themselves, because this has absolutely nothing to do with them.
Well, unless you want to use guilt as a motivator.
Well, yeah. Well, I think sometimes you need to use guilt, but just in general, I think it's important that they should be empowered to not be fearful, but to have a knowledge that they can all, get involved and help you. And, if you're having a rough day, what maybe they could do to help you, as opposed to putting more pressure, stress on you.
I have one quick question myself on this topic, and is there anything for people who have MS that you could give your children to help protect them? Any supplements or vitamin D or anything like that?
So in general, we know there's a couple of factors that have been associated with MS and MS risk, and one is probably low vitamin D levels. There's a lot more data that's supporting that, and I think in our general society, people have low vitamin D levels. So if you can make sure that your child is supplemented well, and that usually is between 400 to 800 units of vitamin D a day, and then if you're concerned, you can also have a level checked with your pediatrician and make sure that they're in a normal range, and you could add more supplements. There's a lot of foods that are rich in vitamin D, including salmon, fishes, and cod liver oil, which no one likes. But so that's one thing. Smoking is a risk factor for MS. So not only smoking in the household, passive smoke. So if you can stay away from smoke for your children's sake, then that's very important. There's more and more data suggesting that that obesity or body weight around the age of teenagehood could be a risk factor. So again, general health is important for kids who might be at risk. And lastly, the other risk factor that we do know about that unfortunately we can't do anything about is mononucleosis. So just be aware of that as a possible risk factor. No kissing, right? Yeah, no kissing. Until you're 25.
Thank you. Okay, we're going to move to the lightning round portion where we're going to answer some of these questions that you have. Would you like to start with Peter? Would you like to start?
Sure, I'll take some in front of me, and I passed out some dietary questionnaires down this way and hormone, pregnancy-related things this way. So,
But also, too, if all of your questions don't get answered, you can come up afterwards and ask a particular, or if you're shy and you don't want something private discussed, you can ask one of the doctors privately.
okay, so there's a question here about what can you tell us about findings regarding Clostridium perfringens type B and the significance and further repercussions? A great question. This is a fascinating story. Tim Vartanian, one of our colleagues at Cornell Medical Center, recently published a paper suggesting that there's a organism that he isolated from one patient's gut microbiome that releases a toxin that can selectively kill the myelin-making cells in the brain. And he's postulated that maybe this could be the very early event that causes MS. Unfortunately, he hasn't found any other patients who actually have the organism, but he has found that about 10% of patients test positive by an antibody test for the toxin that's released. And so it's going to be a little tricky to prove this because apparently it's a very difficult organism to culture from the gut. But it's so important because we just don't know what is the cause or if there is one cause. And it's a very compelling story because this particular organism could explain why the oligodendrocytes might die in MS. So more to follow, but there's no test for it right now, and there's nothing we can do that we know of right now about trying to prevent that organism. It's a Clostridium perfringens, and so people may know that there are other Clostridiums that have been looked at in bowel diseases, something called C. diff, C. difficile diarrhea, but it's not that. It's something totally different that has never been found in humans. It's found in animals, typically. We don't know. We don't know. This is brand new, really.
Yeah, the attention to the what we call the microbiome, which is basically gut flora, is just beginning to be studied. What is currently being done is there are some major studies looking at the DNA of stool samples and seeing if they could identify something that is more likely to be present or not. The one thing I can tell you is cleansing does not help.
It's good to know.
There's a
I
question.
would stay away from antibiotics, though, if you can.
The question about how long is it safe to stay on Tysabri, we don't know, but there's a blood test that tells us if you're at high risk or very low risk for getting the major complication of Tysabri, PML. And so for me, if I test my patients every 6 months, and if they develop evidence that they have more of the virus that can cause PML in their system through this blood test, then I start to get nervous and suggest that they try another therapy. But there are some patients who feel like Tysabri is the only drug that's worked for them and choose to stay on it, even though they're high risk for PML. There are other two progressive questions for you, and actually, there are a few.
We're sharing the progressive questions.
Yeah. Okay, so I have a few more then regarding progressive, if we're going to go in order. So regarding progressive MS, is remyelination more important in progressive than relapsing? Probably not. Probably the way you become progressive is by relapses that cause little damage to your nerve wires, your axons, and accumulate over time to the point where you can no longer compensate. And so it appears that remyelination might be very important to start as soon as possible if we were to have an effective drug. And in fact, a lot of the remyelinating drugs are going to be tested right at the time of an attack with the idea that if you can repair that myelin very quickly, it won't be susceptible to progressive degeneration. A couple of interesting questions about nomenclature. So one person said, my relapsing remitting is already headed towards primary progressive MS. That can't be. Primary progressive by definition never has a relapse, and so it must be secondary progressive relapse. And then the question is, have you ever seen someone reverse? And the answer is yes. It's actually very hard to know for sure if someone is secondary progressive MS, and then I've had a couple of occasions where I thought someone was becoming progressive MS over a couple of years, and then we actually got them on a different treatment, and they sort of plateaued, and I think everyone has seen that. So sometimes we can arrest it in the early stages, in my opinion. And then there's another question about my relapsing remitting MS turned to relapsing progressive. That's also impossible. That term really is progressive relapsing, and it means you start out progressive and then you have a relapse. And so any kind of progressive that follows relapsing is always secondary progressive. But if you've ever had a relapse, you are eligible for a lot of the FDA-approved drugs. And so I think that's an important take-home point. Dennis?
So there was a question from one person who had seen a TV show that seemed to not really gloss over progressive MS and perhaps gave the audience, the viewers, an impression of MS that it wasn't that bad. I think my comment about that is that people that have MS, those who have loved ones with MS, we're all fighting the same disease. Some people are early in their course and have very mild MS. Some people have had it for a long time and have done well. Others have had it for a long time and become very disabled from it. We want to, for all people with MS, instill a sense of hope and help them find meaningful things to do in their lives. But worrying about whether a particular show emphasizes how mild MS can be versus one that goes into the details of how to deal with disabling MS. It's a spectrum, but we're all fighting the same disease, and we should all join hands over that. I had a question about.
So there's a question. My wife has progressive MS to the point of being bedridden. Any suggestions? So I think there's a couple of major things as a neurologist that I want to address with progressive MS or my progressive MS patients. One is making sure that all their symptoms are being addressed. Sometimes progressive MS patients have a lot of symptoms like spasticity. So there's medications, what we call symptomatic medications, which help spasticity. Mood can also be addressed. Depression, fatigue in particular is a symptom that can be addressed both with medications as well. Physical therapy, although it can seem like a lot of work, is very important. And courses of physical therapy, especially if someone changes their status, if they're having more spasticity, if they're having more weakness, is important to do that course to try to regain function and also to intervene and help them in terms of symptoms. Pain is something that's very important to address in progressive MS patients, and making sure that medicines are optimized or causes of pain are alleviated. And then just general maintenance, if someone is not as mobile, so checking for things like mobility sores and making sure that joints are moving as much as possible with passive range of motion is very important. Treatments for progressive MS, as Dr. Calabrese said, this is really the new horizon of MS treatments. And there's a lot of work to address what could be the best treatments for progressive MS, how do we test them, how do we apply them. And there's a lot of new exciting things that are happening. One is that some of the medicines that are traditionally used for relapsing forms of MS are being tested in progressive MS, so that is a new advance. There are myelin repair type of therapies which are now in clinical trials, at least one of them is, and that might hold eventually some promise for progressive forms of MS. And then also the whole field of neuroprotective agents, or agents or medicines that protect the nerves themselves, is a very important field where there's a lot of research focus, and hopefully some of these treatments will come to the bedside soon.
Do you want me to answer another question?
Do you have one on progressive MS?
No. I have about 6 on diet, though.
Well, let's do diet.
I'm going to go this way. So there's several questions about what role diet may play in MS. In terms of, well, for a long time, Dr. Roy Swank advocated a low-fat diet and didn't gather a lot of enthusiasm